Hello, this is Dr. Andrew Olson from Lakewood Animal Hospital. I was going to talk today a little bit about the most common disease that we see in the exam room, and that's going to be by far dental disease. There are a lot of statistics that you can read about. Our website is really good on the information about dental disease and how it can affect your pet. I wanted to talk a little bit today about helping to prevent this, and that's really kind of the thing. We got this young puppy that we want to prevent it in, young kitten. Maybe it's not a kitten or a puppy. Maybe this is a 1 or 2 year old dog. Maybe you have a 10-year-old dog who just had a cleaning, and we want to help prevent this from happening or slow it down. So it's very important to think about their teeth being very similar to our teeth. When say we come home from the dentist, or our dog comes home from the veterinarian and we've just had our teeth cleaned and polished, we are going to start, we're starting from scratch. We've got clean enamel. We're going to start forming plaque in 6 to 8 hours. I mean, it's going to come right back. If that plaque's not removed, then we're going to start having tartar in a day or two. So the big question is, well, how the heck do we remove plaque? The easiest way to do it, just like us, is to brush those teeth. Brushing, just the physical act of brushing, is what removes and agitates that biofilm, that plaque that's on our teeth. This is by far the cheapest and easiest way to do it, most effective, head and shoulders above everything else. And there's a lot of products on the market that are aimed at getting rid of plaque that's not brushing. Brushing is labor intensive. You gotta kind of get your pet into a habit of it. But it can be done. In fact, Carolyn's got a nice blog. If you search around, you'll see her demonstrating on how to brush teeth. If we can't brush for some reason, the other alternatives are going to be something aimed at trying to remove that plaque. So the thing about that is, remember what we said about how fast it forms. If you're going to do something other than brushing, it's got to be done every day. And it goes with brushing too. If you brush once a week, it doesn't work. It's got to be every single day. So things that we're thinking about would be, there's a chemical that's called chlorhexidine that has been impregnated in different things that are designed to have the dog eat them. One of these are these chewies that will have this chemical put in there. The dogs can eat these. They make them for cats too. They can eat these, and just during the chewing process, this chemical goes and removes the plaque. The other that's available is going to be like your greenie. This is a more mechanical removal of that plaque when they're chewing on these things. Now remember, this works only if you do this every single day. There's another one that's actually it's very convenient for a lot of people, and it's effective because they are doing this every day, and that's when we get something that we add to the water. And this water additive is something that when they drink, every time they drink, it's essentially removing that plaque. If we can keep the plaque off, we can keep the enamel free of that bacteria that ends up making all that tartar. The tartar is what ends up leading to all the dental disease problems. So whatever you do, whichever method you pick, make sure to do it every day. Make sure it happens every day, just like you. Imagine how you'd feel if we brushed our teeth once a week or never. But food for thought. We'll hope to see you soon. Give us a call.